Also like to introduce Pamela, who also presented, talking from the perspective of insurers. So thank you very much again from both of us that you participated. It was wonderful.
It was a pleasure.
It was great for us. And maybe you'd also like to sort of summarise some of the key points you were saying and maybe some thoughts for the future as well.
I think what was interesting for me was just the consistency of the themes of what was coming out from both the workshops but then also the speakers. So this is a global problem. It doesn't differ other than maybe, whether you're a low or high income sort of country. And some of the lower income countries, maybe they're in a better position because maybe they haven't got so many clinicians actually sort of serving the individuals.
That's a good point.
So I think from my point of view, I mean, certainly what I see is everything is actually based on activity. So people are actually funded based on the more they do, the more treatment they do, the more money they earn. And that model has to be wrong.
Yeah.
And the patients just don't understand that these people are not necessarily interested in the outcomes. But then maybe they are interested in the outcomes, but they're also ignorant. I think there's a lot of clinicians that are ignorant as well. And I think from a physical therapy point of view, one of the things that I actually see when we actually look at the claims on healthcare plans or claims in the workplace, that actually the physical therapist may understand things like the biopsychosocial model. They might recognise it, but they don't know how to treat it.
Spot on.
And I think that goes back to the education piece that was actually raised, is that we need to educate physical therapists in actually understanding about exercise, because a lot of them don't understand exercise. We need to help them understand how to treat the psychosocial factors. But we actually need to understand things like workplace. A lot of physical therapists don't necessarily understand what work is involved. Those that do work, what work is involved in the issues associated with that. So I think it was really interesting that there was so much consistency, but a lot to do.
Absolutely.
So from a funder's perspective, obviously we've got a big job to do in terms of upskilling and empowering our workforce to deliver high value care. But there are still obstacles in terms of funding of that care because it's not recognised as high value. How do you think we're going to get past that place?
I think one of the ways that you can actually drive change in the insurance companies is with the major corporates.
Right.
But the corporates actually pay a huge amount of money for healthcare for their employees. It's a benefit. And therefore, they're the people that can actually drive change with the insurance companies, because the insurance companies can't afford to lose them as customers.
Yeah.
So certainly, personally, I would actually sort of talk to major corporates and get them working together to help change that model, and that will influence the insurance companies. Then also that can get a lot of media, and that media can then maybe go to the small companies and the individuals, because we have to educate the patients.
Exactly.
Because the patients don't understand. They think doctors are God. They think doctors are great, so they believe they're doctors, they believe they're clinicians, and we've got to actually sort of change that. So I think there's a huge amount of ignorance around all over, whether it be from practitioners, from patients, from corporates. And we need to look at governments. I mean, why are the governments not doing anything about this? Because it affects the state system too.
Maybe because they're frightened about the next election, partly, if they're going to disrupt too
certainly
much.
in the UK, that's true.
Because I think there's a perception that it's the denial of care to consumers, which then creates consumer pressure.
It does, and I think certainly some people I have spoken to, some doctors, they're concerned about litigation, so they think if they don't give the patients what they want, then there's going to be some
So we've got a
litigation.
massive job to educate society.
Massive job.
And what do you think, if you had to give one key issue, because what part of your conversation, part of your presentation was talking about media, what would be the one key issue that how the media could contribute to this positive disruption?
They've actually got to start putting the truth actually out there, because everything that we actually sort of people are, whether it be the Dr. Google, whether it be the news, all we ever hear is about all the things that can go wrong and all the things you need. We never understand about how to do it positively. Part of the problem, though, is that means that us as individuals have to take responsibility for our own health care, and that doesn't sell news. But it's about time it did.